record, please indicate in the chat. Granting recording privileges, and then we'll begin. Over to you, Lorna, in 5, 4, 3, 2.
Hello, everybody. Good afternoon, and welcome once again to a weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgilia, Hispanic Public Information Officer, and joining us today, as usual, is Dr. James Bridgers, who is our Acting Health Officer, Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, Sean O'Donnell, who is Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. And also joining us today is Jennifer Martin, who is the president for the Montgomery County Education Association. Reporters, permission to record on the chat, as well as your questions for the Q&A portion of this presentation. And the format today will be the county executive is going to do his opening remarks. We're going to toss to Ms. Martin, open it up for Q&A with Ms. Martin, and then proceed with the COVID-19 update. We do have a 1:20 hard stop. That is for social media platforms, Facebook, also YouTube, and the County Cable Montgomery channel. But reporters, don't worry, we'll stay here on the Zoom link, and we will continue with your questions. Now, housekeeping is done. To you, Mr. County Executive. Good afternoon.
Thank you for joining us this week, and I want to start by acknowledging this week is Teacher Appreciation Week. And I'm glad that we have Montgomery County Education Association President Jennifer Martin here joining us today. As we celebrate, honor, and appreciate our teachers this week, I think it's equally important to hear from them. And that's why I've invited Jennifer to join us for today's briefing. Before I turn it over to her, I want to thank and salute the 13,000 MCPS teachers, as well as our private school teachers who work so hard to teach our young people. I also want to acknowledge the thousands of support staff in our schools who are critical to helping our teachers. I'm a former teacher myself. I think most people know that. And support staff was critical to being able to provide the services that I was providing. So we're all part of a team, and everybody works together, makes it happen. And at the, centered to all this are the teachers in our schools. And I have a deep appreciation for the work they do, having done it myself. As you look back over the last few years and the unprecedented challenges that our teachers face, none of us could have imagined the adversities that teachers would have had to overcome. They adapted to changes in instruction and flexibility needed to deal with virtual learning, staffing shortages, and protecting themselves and their students from COVID. As we were going through this, I thought of my own experiences as a teacher. And because I taught elementary school, there was a lot of time pre-COVID spent walking around the classroom, going over to a student's desk, looking at their work, talking to them about their work. All these things you did in the course of normal teaching. And COVID made that really extraordinarily difficult. And so I can only imagine the challenges the teachers faced when you couldn't do the things that we know work pretty well and that we actually enjoy doing, and the students benefit from having that personal touch. This week and every week, I encourage everyone to thank our teachers and show them the appreciation and respect they deserve. Teacher Appreciation Week isn't just for students or parents. I'm pretty sure we all have been inspired or changed for the better by a teacher at some point in our lives. It's been a long time since I was a student at MCPS, but I actually was. I went to McKinney Hills Elementary, Montgomery Hills Junior High, and Einstein. But I can remember the names, faces, and lessons of the teachers that made a difference in my life. I had favorite teachers. As a former elementary school teacher, the most appreciated I felt was when I run into students years later, or even when they were adults themselves, and they would say, thanks for something that I taught them. That is a kind of lasting appreciation and a reward, which is just, it's really nice to hear when you hear it. And it's good to know that the work we do really makes a difference for these children as they grow up. Teachers are professionals, and we often take them for granted. We expect them to do everything for every kid they teach. They're supposed to be social workers, guidance counselors, disciplinarians, nurses, and their work does not end when the school day is over. They're always thinking about their students, finding new and innovative ways to engage them. They inspire our children and help nurture the future leaders of our communities in our nation, our world. So I'd like to turn it over to Jennifer now to give a few remarks about the current state of our teachers, as well as some thoughts and ideas about how we can best appreciate her members. So Jennifer Martin, I turn it over to you.
Oh, Mark, thank you so much for those kind words of appreciation for the educators of Montgomery County. You really have lived the experience as a teacher at Rolling Terrace, and you know the challenges that we face. And you have firsthand understanding of the needs of our students, and really more importantly, of their amazing potential. So let me say that we appreciate you too as a fellow educator. It's clear that you care about our students and the people who serve them and their families. We thank you too for working hard to provide a historic school budget for 2023. The investment in mental health services and restorative practices and greater resources will improve our ability to lead our students to academic success and prepare them for a productive, prosperous, and meaningful adulthood. This budget too provides money to improve the working conditions and pay of MCPS employees in order to address the growing staffing shortages we're facing. In the time ahead, we want to work with you to develop policies and programs that encourage more young people to enter the teaching profession and to help us grow a diverse education workforce that includes more men and people of color. The problems facing the teaching profession are no secret. Just yesterday, I visited a school where one mid-career teacher told me she wouldn't be back next year. And it turned out that just as I was talking to her, another young but experienced teacher was in the front office resigning in despair in the middle of the school day. Already this year, 787 MCPS teachers have indicated they're resigning or retiring, up from 537 the year before at this time. Meanwhile, across this state and nation, schools of education are seeing the number of aspiring educators plummet, and many such programs are closing their doors. Putting it bluntly, teachers are burning out. Scripted curricula, endless data collection, and nonstop testing are sucking the joy out of school for teachers and students alike. We must have education policies that empower educators to be creative, inspiring, and responsive to the unique needs and interests of the young people we serve. To attract and retain excellent educators, we must provide better working conditions and salaries that are comparable to what other professionals earn with similar credentials and responsibilities. The county must renew respect for educators' expertise and restore our ability to tailor our lessons for our own students. Teachers honestly deserve more than a week of appreciation. We need real solutions. We need people like you, Mark, who lead with a willingness to listen to educators and who put the money where it's needed in our schools. The educators of Montgomery County Public Schools, thank you for supporting us and our students.
Thank you, Mr. County Executive. Thank you, Ms. Martin. Reporters, we're going to open it up right now for the questions. If you might have any questions for Ms. Martin, and I believe Kate Ryan with WTOP does have some questions. Good afternoon, Kate.
Good afternoon, and thank you for that. And Ms. Martin, it sounds like you anticipated my question, which is we keep hearing about teachers heading for the door. You mentioned this year 787 have indicated that they will resign. Is that right?
So far, that is the number. And there are over, I believe it's now up to about 1,600 school employees who have indicated across the 3 bargaining units that they will not be here next year.
Now, can I ask, is that a direct result of what they've been through the past 2 years, or are we looking at a demographic phenomena where these people have reached the age of retirement so that we would expect, you know what I'm saying?
Yes, I understand what you're saying, because there is a boomer generation like me who are nearing retirement age, but that is not what's causing the great resignation. You know, the people I'm talking about were well in the younger years of their career who have had it. And they're not just leaving MCPS, they're leaving the profession. They're going to other sectors of the economy where their skills are valued more and where they have better working conditions.
And is there anything you see that could put the brakes on that kind of exodus?
Well, I think I mentioned them in my remarks. One is to actually restore the respect for the profession. What's been happening over since before COVID really, has been a movement away from allowing for professional judgment to be something that we're able to exercise in the classroom. The push towards standardization and the focus on being data-driven rather than child-centered has taken a lot of the creativity and joy out of the classroom and is making it a much more burdensome role to have, because you are spending an inordinate amount of time explaining data and capturing data rather than focusing on the students in front of you. So I think that the working conditions, the amount of work that's asked of people, the staffing shortages that mean that we have double duties to perform, those things make the job much less attractive, and students see that. You know, students are in the classroom seeing how hard teachers work. They're not interested in going into the profession. And then of course, the other issue is pay. And, you know, currently there are many better ways to earn, you know, a higher income that would still rely on the skills that teachers are required to have.
Gotcha. And last question, in terms of, I think the stats have been many people who enter the profession leave before 5 years in. Do you know of the people who are leaving this year? How many of those fit that category? Ballpark figure?
I don't have a breakdown of retirement versus resignation, but that's something that I can follow up with you on if that's if those are statistics that you'd be interested in finding.
Thanks a lot. And thank you all for your time on that. Thanks.
Kate, I want to add just something to what Jennifer was talking about. I don't come at this because I'm sympathetic to teachers. I actually know what they go through and what they've been through. And this is a change that started happening when I went into teaching, and there was a shift away from letting teachers teach lessons. You would get a lesson guide, and it would be, you're teaching these principles, these are your objectives, and you were left to do that as, you know, as a professional. When I left teaching, when I got elected in 2006 and I left the classroom, you would get a scripted description. Say, for example, you were teaching a book. You would get a scripted description of what you're supposed to say. It would literally say this, now say this, now say this. That's great if you like to follow a script. No actor, by the way, follows a script as big as what we were given to follow. But if you were in a school like mine and not every classroom had the book that had the script, good luck to you, because the guidance that would normally have been the professional guidance for how to teach the objectives and the principles, there was nothing comparable for the other alternative books other than the one book that they focused on in their guides. And it is extraordinarily frustrating to have to deal with both aspects of that, either not enough guidance to treat you as a professional as you use whatever book you're using, and then on the other hand, having a book which totally scripts you. And it is really changes, and it changed the nature of teaching just in the 17 years that I was involved in the classroom. And it's hard. And when you give high stakes tests, and then you try to figure out in the classroom, where should I place this kid in terms of what objectives they've mastered, and the high stakes tests don't tell you what objectives they've mastered. And they have to spend the first month of school giving MAP-Rs, MAP-Ms, and whatever else they're doing now. All that stuff is time that, you know, well, the value of the testing does not yield, in my mind, things that we can carry over to the classroom. Jennifer, you could, you know, talk a little bit about that, but it is really a change, and you don't do that in other professions. If you're a professional in most parts of the world, you're actually treated like a professional. It's like, go do your job and we'll talk to you if you're not doing it.
Thank you.
Thank you, Kate. Steve Monell, Bethesda Beat, has also questions for Ms. Martin. Good afternoon, Steve.
Good afternoon. Ms. Martin, this is more of a specific question, and the numbers on this are kind of hazy, but there's been a lot of chatter about kind of recent changes within central administration versus the overall teaching pool, and that, the numbers are hazy, but what I've seen is that they're putting about 30 or more administrators in the central office, and they're only going to, for attrition and filling vacancies, it's going to be less than 10 teachers. And again, those numbers we're trying to independently verify, but I'm wondering if any comment on that specific proposal and kind of that development, because that's something that's been breaking this week, frankly, in terms of that change.
So Steve, I've had a quick opportunity to view the new organizational chart for the top of the organization in MCPS. And, I will say that it's dispiriting to our members when we see that central top management is growing, but we are still hundreds of positions remain unfilled in MCPS for classroom teachers. So our feeling as a union is always that we need people who are there working with the children every day. We need mental health professionals. We're short on school psychologists. We are staffing up with our social workers. We need more counselors so that the ratios of student to counselor can be reduced to what is recommended by the professional organizations that oversee counseling standards. We definitely have concern when a central office appears to be having this bloat, and we are scrambling to have enough people to work with children on a daily basis.
What kind of ideas might you or the others in the union have about, this isn't just a problem of retaining counselors or getting counselors and psychologists, everyone's reaching into the same labor pool. So do you have any ideas on, it's not an easy question, but any incentives to try and bring people here, because it's not just a problem, here, obviously, as you know.
Well, certainly we have to make the profession attractive to people, and that means making it competitive, as I've said, with other sectors of the economy, other jobs in other sectors where our skills are valued. So that's, that is something that we work on at the bargaining table to try to negotiate for competitive salaries and benefits. We also need better working conditions because, as Mr. Elrich has said, teachers do not get the professional respect that many others do in their daily work. The fact that we are expected to teach in lockstep and to follow a script in so many cases is, very joy-killing. For both the educator and the students. And I speak to educators routinely who say, what they're being forced to do amounts to educational malpractice because it's not right for the students who are in front of them. And so those are major issues that we are seeking to address, and we're grateful that Mr. Elrich has an understanding of our work and an appreciation for the needs of the students we serve. In terms of other efforts that we can make, growing our own here in Montgomery County, making the profession look attractive to the students who are right in front of us, K through 12, that we have a wonderful pool of talent coming up. And you think about it, if we have high school students today who are drawn to this profession, they'd be ready to hit our schools as teachers in a few short years. So there's an opportunity for us to be thinking about ways to set up teacher academies. We've done some of that work in Montgomery County Public Schools, but there's much more that we could be doing there, and work with Montgomery College and our local universities to try to create a pipeline of diverse and talented young people to come into this profession. But we have to make it a job that people can raise, have their needs met and find joy in as well.
Jennifer, thank you.
Thank you, Steve. Kate Ryan, I believe you have a follow-up question for Ms. Martin.
Yes, thank you very much. I forgot to ask, I wanted to get a feel for, now that the MOU with the school system and the police department is out, do teachers have a sense of how comfortable, or do you have a sense of how comfortable your members are with the new arrangement of the CEOs within the schools and how they will continue to operate?
I would say that overall, our membership has been in favor of adding more mental health professionals and in terms of counseling, psychological services, and to make our schools welcoming and safe places. That said, we also do recognize a need for security. I think that there is, there are a range of opinions as to whether police in the schools are an appropriate response to the safety concerns that students and staff have faced. And so I don't know that there is a unanimity of opinion on the issue. We also have yet to really see how that new policy is going to play out. The goal that we have as educators is for schools to be welcoming, safe places to work and learn.
Thank you very much. I appreciate that.
Thank you, Kate. Any more questions from reporters for Ms. Martin? No? Thank you. Thank you, Ms. Martin, for joining us. Mr. County Executive, would you like to continue with a COVID-19 public health update, please?
All right. So back in the world of COVID, this week our COVID case rates continue to climb, but our positivity rates have plateaued over the last several weeks. That's a good sign. We think we're going to begin to see this current surge begin to recede pretty soon, as we predicted. We'll know that very shortly. It is important to note that our hospitalization rates remain low, and thankfully we're avoiding severe cases and deaths. Currently, we're hovering between CDC community level low and medium, but we're hoping again that our rates continue to decline so we can stay at low community level. 97% of the cases in our region are now the BA2 strain, and we're now monitoring the new BA4 and BA5 subvariants that have been identified in South Africa. These two new strains of COVID are more transmissible than the current BA2 strain and could even evade antibodies from vaccinations and prior infections. So as that strain develops and spreads where it is right now, you can probably pretty safely say that all eyes in the medical community are going to be focused on hospitalization rates and severity of cases and what happens to people who've already had either COVID or been vaccinated. And does this have the ability to jump past some of our antibodies? And that's obviously the crucial question that everybody looks at with every variant of COVID. It's one thing if our antibodies and vaccinations confer at least protection from hospitalization and severe illness. It's another thing if the virus develops an ability to jump beyond that and create even greater threats. So we're paying attention, and as always, we'll continue to keep you updated on where we sit with this. As we prepare for this new variant, we're going to continue to focus on our vaccination and boosting efforts, as well as those, particularly for those who are most vulnerable to COVID, which are our older residents and those who are immune compromised. And we still have, the younger children are not yet eligible to be vaccinated. Hopefully some movement will occur with that. But we're paying attention, particularly to the people we know, if they get it, are most likely to have the most severe outcomes. And obviously we need people to get boosted. We talk about this every week. And every week we talk about it. If you haven't gotten boosted, the effect of your immunity likely declines a little bit. So at some point, the protection you get is not going to be the protection you had when you first got vaccinated. And that is going to put you at greater risk, and not a good time to be at greater risk if you're going to have variants that are actually more transmissible. So hopefully people think about this. Again, I dearly wish that, people had never talked about this being like the flu, because all of us say, yeah, I'm ready for my annual flu shot. For this moment, annual is not what these shots are. These shots are probably 4 or 5 months between the need for boosters, maybe 6 months, but they're sure not annual. And you hear the companies talking about an annual shot. We'll be the first to tell you when the shots are annual. But in the moment, what you know about the flu and how often you need to get vaccinated is not true or applicable to COVID at this point. So get vaccinated. I want to take a minute to just talk about the Supreme Court and the kind of the horrible news out of the court this week. This is a health-related issue, health-related in the most fundamental sense, that a bunch of men have no right to impose their religious views and tell women what to do with their bodies. That's just the starting point for how absurd this decision is, if that becomes ultimately the decision. I'm just pretty shocked and outraged about the draft that was leaked. I hope the leak stimulates people to mobilize, because this would be a major step back for this country. Maryland is, and you can see on if they put the chart up, you can see Maryland's one of those states where abortion rights are protected. But our concern would be, at least in Maryland, what happens to federal funding for programs that provide abortions to people who don't have the economic means to have them, or the economic means to get, for example, a pill. And if that becomes a problem, then we're back to the days of a woman not having to carry either an unwanted pregnancy or doing things that would further endanger their health in order to terminate that pregnancy. And we should not be going back to those days. It's a complete regression. It's an attack on women's rights, freedoms, and their health. It's another case for why we should have passed the Equal Rights Amendment, so there wasn't any question. You would never be able to get away with this stuff with men. And the idea that you can get away with it with women is just, in my mind, outrageous. As much as this news has been focused on the abortion issue, this is a slippery slope, as I said, in terms of the impact on federal funding and protections towards women. 2 months ago, we had Delegate Kelly on this media briefing to highlight the work she and others were doing in Annapolis to protect the rights of women. And I'm glad they passed their legislation during the 2022 session of the Maryland General Assembly that recently ended. Fortunately, we live in a state where a woman's right to choose still matters and is not under attack. Additionally, in my FY23 recommended budget, we have proposed over $34 million of minority and community health services, which includes women's health services, maternity services, and a Montgomery Cares program for uninsured adults. But if the Supreme Court rules to overturn Roe versus Wade and Republicans take back Congress this year, we're going to see an erosion of federal funds. They've already tried to do it in the absence of a court ruling, and you can bet with a court ruling, they will do everything they can to take the federal government out of participating in this aspect of women's health care. And we would not be able to make it up at the state and local levels. I also fear that despite their protestations, to the contrary, that once you've decided that you're going to flip a previous decision the way they have, and then they said, well, we're not going to apply this to other stuff. Supposedly, they weren't going to flip this decision. Many of them in their confirmation hearings said this is something that they considered settled law. So if it's not settled, then the question is, what is settled? And your other targets are same-sex marriages, interracial marriages, and other civil rights activities. So this is seriously a concern, and I hope this leak energizes advocates, activists, as well as others who've not been in this fight before to step up, speak their voice, and vote. We're in this position because elections have consequences. We're seeing today are the consequences of the election of Donald Trump and his 3 appointments to the Supreme Court, as well as the Republican Congress's refusal to take up the last Democratic appointment when they could have appointed another Democrat to a vacant seat. So elections do indeed have consequences, whether it's a woman's right to choose for her own medical decisions, same-sex marriage, or aspects to healthcare. These are all issues that most Americans support overwhelmingly, but they're being trampled by minority viewpoints representing us at the federal level. It's pretty unfair, and it's pretty un-American. in budget developments in the county, I want to thank the county council for the unanimous approval last week of the labor agreements, which lay out enhancements in compensation and benefits for our county employees as we address the impacts of COVID-19 and the great resignation. We know that we face tough competition and recruitment and retention of talented employees. We're facing, a piece of the great resignation ourselves. And so it's really added to the challenges of bringing back our workforce. The council's actions give us the tools we need to recruit and retain workers needed to continue to provide services that county residents expect. I am concerned about council staff's recommendation to cut $40 million that we allocated toward naturally occurring affordable housing fund in the county. You can see this chart goes from 2000 to 2030, and it shows between 2000 and about 2017, the number of naturally occurring affordable housing units dropped by a little over 19,000 units. And Park and Planning is projecting the loss of between another 7,000 to 11,000 units between now and 2030. So by 2030, we could be down as many as 38,000 affordable units. I can assure you that the population of this county that needs those units has not declined. As you can see from the chart, over 25,000 unrestricted units of affordable housing that serve people earning under 65% of area median income. That loss of that housing is really critical. Our MPDU program does not produce nearly enough moderately priced dwelling units. In fact, by definition, it produces moderately priced dwelling units. As anybody remembers, when this program started, it was about housing teachers, firefighters, and police. People earning less than $60,000 are often not served. If you look at the apartments in Bethesda that are MPDUs, you'll see 1 bedrooms that are close to 1,600 and 2 bedrooms close to 1,800. And the jump to market rate units is often $1,000 or more. So if you make too much to fall under the top of the MPDU category, you're going to struggle to find any housing that's reasonably priced. And if you make under our limits, you're going to struggle to find housing that's affordable flat out. That's why we've got over 20,000 people earning around $30,000 income, paying 50 to 60% of their income on housing. If anybody thinks MPDUs will save us, we have a whopping little over, I think it's a little over 6,000 of rental MPDUs in the system over the years, because the early years of MPDUs had expiration dates. While we created more MPDUs, we've also lost a lot of those MPDUs. So that supply will continue to dwindle even as we try to add additional MPDUs to the reserve we have. The dedication of county resources in the Natural Occurring Affordable Housing Fund will support a focused effort to preserve these at-risk properties and will provide much needed additional capital to preserve and create units. And I can tell you, when I was on the council, on multiple occasions, affordable housing advocates would come to me and ask if we could persuade the executive branch to make more money available, because there were buildings they could have bought and protected if they had gotten access to funds, but they couldn't get access to funds. And that's why we've lost so many units. We did not have the ability to protect units and to make quick decisions to use the right of first refusal. And we need to be able to do that, and this fund will help us do that. On another topic, this month we're celebrating Asian American and Pacific Islander Heritage Month. I want to acknowledge that this week is also the beginning of our Asian American Pacific Islander Month. Accounting for nearly 16% of the county population, our Asian American and Pacific Islander population is made up of over 20 different ethnic subgroups. Over 40% of the state of Maryland's Asian American and Pacific Islander population lives in Montgomery County. I'm looking forward to attending various events around the county this month. And for many in our community, this will be their first AAPI event in person in 3 years. And later this month, on May 22nd, will be hosting our AAPI Heritage Month celebration at Marion Friar Town Plaza in Wheaton. And we'll also be holding virtual events and doing social engagement over the month. I also want to remind people that this week is also National Correctional Officers Week, and I want to thank all of Montgomery County correctional employees for the dedication, professionalism, and commitment to serve and protect our correctional and rehabilitation inmates, as well as our efforts towards improving their lives and reducing recidivism. These employees have very difficult jobs to begin with, and working under pandemic conditions over the last 2 years has made their daily challenges even more difficult. These folks are working in crowded conditions with incoming new population on a daily basis. They did not have the luxury of teleworking. This is not a job you can phone into. And so these folks were at risk in close quarters in closed buildings throughout the worst of the pandemic. So I think they need a special recognition from us for having stayed on the job, gotten their job done, and made it possible for us to do what we needed to do. And I just want them to know that I appreciate their service here. And finally, Mother's Day. I want to wish all the mothers, aunts, guardians, grandmothers in Montgomery County a wonderful Mother's Day this upcoming weekend. Please remember to not only show appreciation to your mother, and also send my appreciation to my daughter, who's a mother, but to all those who are mother figures in your life. And I'm now going to turn this over to Sean O'Donnell and Earl Stoddard for their updates.
Thank you very much. So today's update from our Pulse report will be a little bit quicker than some of the previous weeks. As our county executive has mentioned, we've seen our case rates continue to climb at a steady rate. We saw a little leveling over the weekend, and the early report from Maryland Department of Health's aggregated PCR testing data is that this will go up again a little bit more today, likely in the 190 range. Again, we're hoping we have this projected to slow at some point around this week, potentially into next week. And that would be consistent with the other BA2 group waves that have happened in other parts of the world. Again, this is not a very steep slope here. And most importantly, we are not seeing those significant illnesses resulting in hospitalizations. Those transmission rates, again, as was mentioned, have leveled off over the last week or so. And again, with that hospitalization rate, you can see how much lower that is from previous waves of COVID activity. In fact, we've actually seen some decline in the overall hospitalizations since the previous Monday's census. We'll continue to track that closely, and we are encouraged that many of our partners in assisted living and nursing homes are working hard to try to protect the most at-risk individuals who are in those settings and try to prevent severe illness with them. So once again, we are of course tracking the deaths, and we've seen now that we've gone through April. They are significantly lower than the previous several months. These numbers might fluctuate a little bit as some of the confirmation of causes of death can take sometimes an additional week or two to confirm it as results come back. Again, we think it's very, very important to share the data we have on the death rates by vaccination status, even through this wave, and at these low levels of deaths over the last month. You can see that the importance of being boosted and being up to date on your vaccinations. And just again, sharing for your wider audience, we're tracking on the variants. Right now, what we're seeing is almost exclusively the variants related to BA2. And again, we are tracking on variants that are occurring in other parts of the world and are spreading a little bit more. And we're looking very closely at how those transmission rates occur, how protective previous immunity is, both in slowing transmission, but also in preventing serious illness. And looking across the world, again, we are continuing to see decreases in most parts of the world with COVID activity. The US is up 26% over the last 7 days. And this is, again, as BA2 and its other subvariants are spreading around the country. Not much change in the overall vaccination levels in the county. We're continuing to offer vaccination clinics, both at county locations and of course at many of the private sector locations. And you can see there are still a good number of people coming out to get that second booster, and some people are getting their first booster now. If they haven't and they're eligible, we strongly encourage them to do that. It is, again, the best way to protect against COVID. And again, you can see how the testing, PCR testing that the county is providing has gone up a little bit over the last few weeks. It's still not significantly elevated. That, of course, is likely because of the large proliferation of rapid tests, both available through the libraries where we distribute them, as well as through the private sector. It very well may be the difference between what we were seeing in testing levels during previous spikes and what we're seeing now are those rapid tests. Again, I just want to highlight at this point with the increased with the increased transmission rates, but low hospitalizations, we're still focusing a lot of public health attention on those high-risk settings, the congregate living settings, other congregate settings like schools. We're continuing to work with our MCPS partners and our school health partners to monitor both the screening they're doing in schools as well as the symptomatic testing. And we're in regular communication with our nursing homes. We're very encouraged to learn that they are accessing antivirals and the monoclonal antibody treatments. And that may be part of why we're seeing low number of transfers over to hospitals of patients there. Again, just strongly encouraging anybody who's going to visit a loved one at a nursing home or assisted living, please test before you go, because this is spreading in many cases asymptomatically, and we want to make sure we don't introduce new infections out there. Finally, before I turn it over for any additional questions, I just want to wish my mother a happy Mother's Day. Ann O'Donnell, look forward to seeing you soon.
Thank you, Mr. O'Donnell. I believe Dr. Bridges and Dr. Stoddard do not have opening statements. So let's proceed with the Q&A portion of the presentation. Steve Monell, but that's a beat. I believe you have questions for the officials.
Yes, I do. Thank you. Sean started to go into this, but just looking at the charts and the dashboard, and any health official can field this, I guess. Obviously we've seen cases start to tick up, but in this wave, hospitalizations thankfully remain low. So just what have you all been able to determine about why that is, I guess?
Well, I think one way or the other, we're increasing our immunity. Obviously we've seen an uptick, and I think Mr. O'Donnell was alluding to this, even as we've seen the second boosters have helped encourage some of the first boosters to come in. But I also think we've seen tremendous transmission over a 2-year period. And so the further on this we go, the more we build up immunity based on infection in addition to vaccination. So the more B and T cell immunity that we have from previous exposures and vaccinations, the less likely it is that future variants will cause as severe illness unless there's a major change in that variant. So the BA4 and BA5 are obviously sublineages of the Omicron strain. And so I would anticipate that hospitalizations would not uptick with those either, but they are more transmissible. There's a clear favoring in this virus to become increasingly transmissible. So the frequency of cases will likely continue to increase, even if the frequency of hospitalizations does not. Dr. Bridgers?
Sure. Just to add, Stephen, thank you, Dr. Stoddard. And along those lines, we continue to increase our precautionary messages. We know over the past 2 years, we've reinforced and overemphasized those public health measures. So we know, as Mr. O'Donnell indicated, wearing well-fitted masks in congregate spaces or spaces where there's limited physical distancing. We know that individuals should test, or if they become infected and test positive, they have a 5-day window to get antiviral treatments. And, we have, more importantly, re-expressed that now that folks are traveling more and going to other spaces where they may have higher case counts. And then lastly, we continue to educate the public on staying up to date with their vaccines. Up to date is the key. Being up to date, as our county executive indicated in his opening comments, as far as which includes those boosters. So we backed away from being fully vaccinated to more emphasis on being up to date.
How much, we discussed about how this community kind of has been receptive and kind of followed. I see going to the grocery store sometimes a lot of people still wearing masks. And I guess the question I have is it kind of tricky because, as positive cases come back up, do you all have gotten the sense of, are we testing more than kind of our peers in the region, or at least going? And I'm wondering just what your overall sense is of that.
Sure. Great question, Steve. I'll respond to your question because we actually have been monitoring the testing capacity in other jurisdictions. We are slightly lower, or have been slightly lower, since we've seen these wavelets that Mr. O'Donnell talked about, where you see the uptick and then it'll go down a couple of days and it'll go back up. DC is the only, based on the data that we've been reviewing in the area, that has a slightly higher testing volume over a 7-day period. I think they've been averaging around 50,000 and we've been around maybe 40,000. So we have been monitoring the level of testing and identifying those tests and reporting those results. Those are PCR-based results, and we know that there may be other rapid tests that have been may have been unreported, but we're monitoring and tracking those as well. So the messaging is clear that if you feel ill, asymptomatic, test, isolate, along those messages, public health messages.
And the last question I have, I think the county executive might be best poised to field, but yesterday, the council extended Adriana Hochberg's term as the director of environmental protection. Is the interview process started to kind of, I know Adam Ortiz left for the EPA. Is there any update on where the interview process is for that? If that's started, just kind of where that stands.
Mr. County Executive, please unmute.
We'll be dealing with this
There.
after the primary. That's our goal.
Okay.
Thank you, Steve. I believe Kate Ryan, WTOP, has questions for you, Dr. Bridgers. Kate.
Thank you. Sorry about that. It took me a second to reach that key once again. I had a quick question based on a report in Maryland Matters on concerns. I think it was Clarence Lamb in the General Assembly who said he's concerned about the Maryland health data. The latest health stats come from 2019. There's been a long lag. And his quote was, again, according to Maryland Matters, it leaves health officials flying blind, that there's a lot of information that they're not getting. Do you share that opinion that because you don't have these, and I think it's the Maryland Vital Statistics Data Annual Report, do you share that concern? And I open that up to either Mr. O'Donnell or Mr. Stoddard as well. But Dr. Bridgers, your thoughts?
Sure. Great question, Kate. And I'm sorry I missed your call on Friday. So there are some concerns about the lag in data, but the key to that lag is that we proactively continue to monitor the data. So around 2019, 2020, we entered in the pandemic. We used some of the data that was reported as far as access to care, equity, the social determinants of health to help inform some of our COVID responses. So the data had meaningful use. And so we use some of that, and now coming out, or on the other side in 2022, having been through COVID 22 months, where did that land? Are we able to use some of those indicators? We know that some of the indicators, such as lower respiratory illnesses, played an impact in how it affected those individuals who are foreign-born and now live in the county. Also looking at our access to care and diabetes management. And so we use some of that data, and we're hosting a town hall tomorrow to talk about some of those metrics and how they may impact our maternal and child health programs going forward, and working with our community partners, chronic disease management, and working with diabetes and the Kidney Foundation. So we use some of that. So the data has use. And so how do we translate that data from 2019 and use it to bridge the gap from 2019 to 2022 to have more effective outcomes going forward?
Yeah, the only thing I would add is, if it's not obvious, the epidemiologists are a very valuable resource, and they're to some degree a limited resource, that's available. And I know that their attention's been turned to COVID, to producing lots of important information to help guide us during an emergency response. But that said, we have been reaching out, I know in the county, to do that and to do other things. We've not only relied on the epidemiologists that work here in HHS, but we've reached out for partnerships with NIH and with Walter Reed, and had residents who've come through and worked with us for months at a time, helping us do things. But even then, there may not be enough epidemiologists to do all the evaluations and that we would like to do. So we pick and choose the most important things. Again, we are looking forward to getting more of that information from the state. Particularly, we're very interested in how influenza rates have been impacted the last 2 years by all of these other protective measures we've done for COVID. And we can certainly learn about things going forward. So it's a good question, but I do understand that resources have been work. It's not that they haven't been there; they've just been working on other things.
Thank you.
Thank you, Kate. I do not see any more requests for questions from members of the media. Going once, going twice. Well, thank you everybody for joining us today. Stay safe. We'll see you again next week. Have a great afternoon.
Good afternoon, everyone. Thanks a lot.
Bye-bye.